Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Centre, IVF Pune. Today, we are starting a new series of IVF in special situations. So today, let us see the first scenario, IVF in a lady with multiple fibroids. Now, what are these fibroids we have seen in the previous videos which we have made? Fibroids these are actually the masses which come from the muscle of the uterus. The fibroids can be on the top of the uterus, which are the subserous fibroids, in the body of the uterus where the baby actually lives and which expands for 9 months, which is intramural fibroids, and inside the mucosa where there is the endometrium, which is the submucosal fibroids. Now, there are certain patients in special situations in which the uterus is studded with fibroids. So, this patient has multiple fibroids. Now, how do we do such kind of challenging cases? First of all, whenever we have any fibroid more than 4.5 centimeter, irrespective of whether the fibroid is giving her symptoms like bleeding, pain in abdomen, menstrual pain, pain during sexual intercourse, pain during urination or defecation, it must be removed. For fibroids which are asymptomatic, that means fibroid is present but she is not even aware because there are absolutely no symptoms, but the sonography shows more than 4.5 centimeter, then only it should be removed. In asymptomatic fibroids which are smaller in size, if it is not hampering her endometrium, that is the place where your baby lives for 9 months, then it can be retained. So basically, not all patients of multiple fibroids need to undergo a surgery for fibroid removal. If your fibroid is coming in the way of implantation of your baby, irrespective of size of the fibroid, it must be removed. Luckily, nowadays, because we do keyhole surgeries, so hysteroscopy or laparoscopy is the mode of surgery for fibroids. So it is basically painless, only one stitch, no stay required. Patient can work immediately from the next day of the surgery and is a lot more patient friendly as compared to open surgeries. So in a patient of multiple fibroids, before going for IVF, cleaning up the scenario is very important. If the endometrium is involved, then only the surgery would be required, or if you have a huge size of fibroid. Otherwise, you can straight away go ahead, do the IVF, make your child, and go ahead for a planned frozen blastocyst embryo transfer. And we sometimes give 1 or 2 injections to temporarily reduce the size and the effect of these fibroids on implantation. So this was all about multiple fibroids and IVF, which are certain challenging cases in test tube baby technology. Thank you.